I have to get that raised too. I don't know what they it's not that.
Juliana, I don't know if maybe I want to mute everyone and then I can unmute them when they get a chance. Oh, there we go. Looks like things are handled now.
Yeah, we're all good.
Okay. All right. We have a lot to get through in just an hour. So I'm going to go ahead and get started. And again, if you're just joining, if you're able to mute, that would be lovely. I did want to let folks know right away that we're recording this call. We're recording it in part so that folks who are unable to make the call today are able to join. Since we do have a lot of folks on the line today, I don't think we're going to be able to go through individual introductions, but I'm hoping folks are able to share their name, their state, their organization in the chat, and then also if you're feeling a little fun and you want to do a little icebreaker, some sort of favorite diaper related memory. And while you're doing that, we're going to introduce ourselves and we'll go through the agenda and then we'll run through what we hope to share with you guys today. And I do want to apologize because this webinar feels a little out of order for how we would have ideally started our relationship with you all, the third cohort of the DDDRP initiative. We work for Westat, which is a research and evaluation company, and in partnership with Public Profit and Dr. Jennifer Randles, we've been contracted to conduct the evaluation of the DDDRP initiative. You'll be seeing a lot more of us in the future, including a soon, maybe tentatively, I think, scheduled for the 16th introductory webinar that will really share the evaluation design, the components, our approach, our timeline, and your involvement in it. So I ask that for now you just bear with us as we get you this really important diaper ID information to help you be able to get started, since I think some of you are ready to enroll your folks now, and we'll be able to pull back and have a more introductory and larger discussion in the future. So for now, let me introduce myself. I'm Allison Hyra. I'm the project director of the DDDRP evaluation, and I'm based in Virginia. I do this diaper-related memory icebreaker a lot, so I'm going to mix it up this time and talk about how where I'm from in Indiana, one of the obligatory gifts at a baby shower is what we call a diaper cake, where you take like 2 packs of diapers and using an intricate model that I do not yet understand, shape an entire like 3-tier cake out of diapers. And then the expectant parents can take that back home and use that as a starting package of diapers for their kiddo. And I'll turn it over to my colleague, Amanda. And if you're speaking, Amanda, you're on mute.
Sorry, when you said everybody mute, I took it too literally. Hi, everybody. I'm Amanda Hare. I am leading the diaper ID efforts for this evaluation. I am based in Maryland, and my favorite diaper memory is when my first niece was born when I was 9, and I changed my first diaper and just thought I was so cool to be an aunt at age 9.
Great. So we've got a lot of stuff to get through. We have a couple places that we can pause for questions, but I want folks to just raise their hand or interrupt us if there's a question that you think that we are not getting close to answering. I have a hard time seeing the screen without having a second screen. I'm presenting from home today, but I think Amanda or Sarah can interrupt me if they see some hands raised, and I'll do the same for Amanda. Thanks. Okay, so what are we going to do today? We've got a lot to cover today. First, I want to give you just enough information about the evaluation so you know why we're asking you to implement this whole diaper ID process. Then Amanda is going to walk you through the who, what's, whys, and hows of diaper IDs. I'll jump back on and share our troubleshooting tips of things that we've learned from piloting this test with a couple cohort 2 grant recipients. And then I'll make sure that you have our contact information. So as you're starting to get started, you can shoot questions to us at any time and we can help you walk through it. And then I did want you to know, in addition to this recording that I think will be posted on OCS's website, but if not, we'll send a link. We're also developing a sort of correspondent written guide that folks can print out or save to their virtual desktop that they'll be able to pull from whenever they start this process as they're trying to remember what it is exactly we're asking folks to do and how. All right. So as most of you probably know, the DDDRP stands for the Diaper Distribution, Demonstration, and Research Pilot. It's the first ever federally funded diaper distribution project, and it's been funded by the Office of Community Services in the Administration for Children and Families. The program's purpose is to strengthen and expand existing diaper distribution services through a robust network of community partners that provide anti-poverty services. Then our team comes in as the evaluators of this entire initiative. And our purpose is really to just understand what it all is that y'all are doing and how people are experiencing the programs. And then we're also attempting to establish a foundation for a more rigorous future evaluation. Our evaluation is structured into 3 different related but distinct parts. The first part is a process evaluation. And in that part, we're going to study and document all the ways the 3 cohorts of grant recipients designed and conducted their programs. We'll ask questions like, how did you build your team? How did you determine where you will get your diapers from and who you will serve? How did you engage with your families? The second part is called a participant experience and outcome assessment. And this is the part of the evaluation that the Diaper ID will support. In this part of the evaluation, we want to document who received diaper services, what they looked like, what their characteristics were, what kind of services they received and for how long, and what their perceptions are of the program. We also want to begin to explore how we might be able to compare family situations or levels before they started receiving diapers to after they've received services for a while. The third part of our evaluation is to help us collect the kinds of information we need to know to be able to design an impact study, like maybe a random assignment or experiment that would allow us to say the extent to which diaper distribution programs are causing or are responsible for changes that families experience, such as reduced financial stress, better child health, or increased participation in education. I just want to let you know right off the bat, you won't be participating in any impact study. That's a later future contract. We're just learning what we need to know to be able to design an impact study that would be able to accurately and credibly capture such impacts and outcomes. So this slide tells you about where we're going to get our data from. And we're going to get our data from 3 different streams, but I'm not going to focus very much on this slide because, like I said, we'll talk about it in about a week or 2 in a more introductory webinar. We will conduct site visits to each grant recipient. We're also going to rely on grants for some data, and I can talk about that more in our design choices discussion next week. 2 components of that second sort of column in the slide include information that we will be collecting through the Beneficiary Enrollment Survey, which is related to the Diaper ID. The information will include participant demographics and their baseline levels of important measures of interest. Like I said earlier, child health, financial stress, etc. So today we're going to focus on how the Diaper ID will allow us to leverage the Baseline Enrollment Survey, or BES, to answer our evaluation questions and to help you better understand your participants as well. Before we do that, though, I do want to spend a couple minutes talking about the BES. So the BES was developed by the Office of Community Services to ensure that they are able to track and report on real-time enrollment data. It's an online SurveyMonkey form, and it's coded for each grant recipient. And if you don't have it already, you will get it from OCS soon. And OCS has also translated it into multiple languages. If you need that support, please let your program specialist know. Now, the backstory behind this is that the initiative began before the evaluation contract was awarded. And so OCS really wanted to be able to understand something that was happening on the ground with grant recipients, even before a formal evaluation was able to really get going. Then as we started to do our planning, we realized that we didn't really want to burden grant recipients with a whole bunch of additional data collection efforts. So we, in conjunction with ACF, agree that the BES is a great source of participant information and that we should leverage it to the extent possible. Because the BES is used to count participants, we only want you to field it once at this time, just at intake or diaper receipt. It's not a tool that people should be asked to fill out each month. We will work with you in the future to collect similar data a second time from families as an outcome measurement, But we're going to talk about that in the future. That's 6 to 9 months from now. So at this point, please do think of the BES as a one-time tool. And then finally, because the BES is used to count the number of children served by the DDDRP program, it's really important that we get one BES response per family, but only one BES response. So what does this mean? It means that we don't want mom to fill it out the first time she comes to your organization to get diapers for her 2 kids, and then also have grandma fill it out a second or third month later when she comes to get diapers for those same kiddos in a subsequent visit. And then in case you haven't seen the BES in the wild yet, I just did want to give you a little overview of what kind of information it collects. It's a pretty quick tool, depending on how many children the caregiver is responsible for. It should take under 10 minutes to complete. And it captures stuff like caregiver and child demographics, so age, race, ethnicity. It captures things around early childhood education participation, whether a kiddo goes to daycare or early Head Start or Head Start. It captures information around household income. It captures information around diaper need and the associated stressors or challenges around diaper need. It captures information around caregiver employment. And then finally, it also captures information around kiddos' diaper sizes and whether they've been screened for or diagnosed with any special needs. I want to pause here for a second and see if there are any major questions about the evaluation overall or what the instrument is that we're talking about applying the diaper ID to, and then we can get into talking about the diaper ID more specifically. Anyone have any questions that they need clarifying on now? Great, and we'll have more time to talk at the end. So I'm going to go ahead and pass this over to Amanda at this point.
All right, thanks, Allison. So as Allison mentioned, to ensure that the BES data are useful for grant recipients and for the evaluation, it's really important for each family to be assigned a unique identification number, which we're going to refer to today and henceforth as the diaper ID. So this part of the webinar will talk through instructions for grant leadership, data management staff, and intake staff to assign and document diaper IDs for each family receiving diaper supplies, the what, why, and how, essentially. So first, what are diaper IDs? Assigned to each family receiving diaper supplies, diaper IDs are 8-digit numbers with the following characteristics. First, it's important that they're unique. No 2 families across the entire federal DDDRP program will be assigned the same ID. Second, diaper IDs are disguised. So this means no family will be assigned an ID that includes any sort of identifying information. So really, you can tell nothing about the actual participant by looking just at this number alone. All right, next, why diaper IDs? Diaper IDs will benefit grant recipients and the evaluation teams both. Grants will be able to use families' BES data that OCS provides to understand and improve their programs. Sorry.
So hang on real quick. I don't think I should be in this meeting.
I just muted Andrea. I think we can
Thank
keep
you.
going. Yeah.
All right, thank you. So I'll start over. Grants will be able to use families' BES data that OCS provides to understand and improve their programs. Without a diaper ID, there would be no way to link BES data to data that you have in your management information systems. And second, the evaluation team will be able to link data from before and after program participation to assess changes over time in participant outcomes. All right, so most importantly, how will staff assign diaper IDs? The idea is that staff distributing diaper supplies will use a web-based diaper ID generator, and that image on the right side of the slide there gives you an idea what it looks like. We'll also spend some time testing it out today. So, but generally, the diaper ID generator will return an 8-digit unique and anonymous diaper ID. And this simple tool works on any device with an internet connection. So you could use it on a tablet, your phone, a computer, any of those would work. Second, it requires no special software. You don't have to download anything. And it can be used by multiple staff simultaneously. So if you have multiple staff conducting intake at the same location or at different subrecipient sites, that's fine. There should be no problem with that. All right, next, Allison. So this tool will be used to generate a unique number that staff should record for each family receiving diaper supplies. So it's important to understand sort of what this is and what it's not. So first, the tool produces a unique number, but it's not a data entry tool. Staff must record this number for each family. Second, the number is for evaluation purposes, but it does not replace any other ID numbers that you might use. And third, this number should be assigned at the family level, but not individually for each caregiver or for each child. So staff conducting intake can access this diaper ID generator tool by navigating to the link on the screen or scanning the QR code showed on the screen. And I'd love to give it a try now. So take a minute and you can either type in this link or you can use your phone to scan the QR code, navigate to the tool, answer the questions on the tool as if you were conducting intake for your site, document the diaper ID by dropping it in the chat, and then click Clear ID to enroll new family. And I'll pause for a few minutes while people give this a shot until I see some diaper IDs popping up in the chat, and then we'll continue. One thing I do want to note while you guys are giving this a try, the organizations listed in the tool right now are based on the subrecipients grants listed in their original grant application. So there might have been some changes since then, that's possible. The way that we are trying to update the tool based on any changes that have happened since your grant application is through that Google form that we shared earlier this week. So if you haven't already, please, please, please complete that Google form so that we can incorporate any new subrecipients that you may have. All right, so I'm starting to see some unique IDs coming in. Notice how those diaper IDs in the chat are unique, meaning no two are the same. And they're disguised, meaning that you can tell nothing about the actual participant by looking at this number alone. All right, so assigning the diaper ID is relatively easy, but what will be really critical is how you document it. By documenting the ID, you'll be able to link BES data to your service delivery data, and we'll be able to link data from before and after program participation. But another reason it's really important to document the diaper ID is because you will be required to use it again at outcome measurement. As Allison mentioned, we'll be doing outcome measurement in 6 to 9 months, and you'll need to pull that diaper ID out of your data system so that you can use it again then. So how can you document it? That's the big question today. The first step will take place before sites begin enrolling families. Grant leadership or data management staff will add diaper ID fields to their management information system and to their intake form. This process might vary if the grant recipient's intake process varies. So for example, if a grant recipient has many recipients with different MIS and intake forms, then they'll need to add a diaper ID field to each one of those. If there's just one subrecipient, or if each subrecipient has a consistent MIS and intake form, then you would only need to do it once. After grant leadership or data management staff have added diaper ID fields to their MIS and intake form, documenting diaper IDs will be an iterative process. So everything you see in this blue box, intake staff should complete whenever a new family is enrolled. So that includes that when a family arrives for diaper supplies, staff conducting intake will search the MIS to determine whether the family has already been assigned a diaper ID. Of course, as staff begin enrolling families, the families will not have diaper IDs, but over time, more and more will already have diaper IDs. They'll be returning month after month, and those families that have already been enrolled will already have diaper IDs. So checking whether a family already has one will help avoid duplicates in the BES and in your management information system. So it's really important that staff search the MIS via multiple pieces of information. So for example, if the MIS is organized by child and the family includes more than one child, check both children's records for a diaper ID. By contrast, if the MIS is organized by caregiver and the family includes more than one caregiver, check both caregivers' records for a diaper ID. Child or caregiver dates of birth and social security numbers might also be potential search options in case names are misspelled or spelled differently by different staff over time. So the bottom line is always search by at least 2 pieces of information before determining the family is not in the MIS, and that will help us all avoid duplicates. All right, as staff begin enrolling families, the families might not have diaper IDs. I mentioned this already. So if this is the case, use the diaper ID generator tool that we just walked through to assign a new diaper ID, enter it into the intake form, and ask the caregiver to enter it into the BES. If the intake form does not automatically populate the MIS, staff will need to enter the information from that intake form, including the diaper ID, into the MIS after intake. So Allison, next slide, please. So this will certainly be necessary for paper intake forms, but if you have an electronic intake form that potentially automatically populates your MIS, then it might not be necessary. It depends on your system and your process. All right, so by contrast, if the family already has a diaper ID in the MIS, this indicates that the family has already completed enrollment and does not need to complete another BES. However, if your grants process includes completing an intake form at each visit, then you should use the existing diaper ID in that form rather than assigning a new one. This depends on your process again. If you don't complete an intake form at each visit, then you can carry on without it. I see there are some questions in the chat. I think it might make sense for Allison to go through the troubleshooting tips first, because I think it might answer some of those questions, but we will have time at the end to discuss any other questions that still remain.
Great. Thanks, Amanda.
Yeah.
All right. So like I said, we worked with cohort 2 grant recipients to figure out like kind of troubleshoot or identify in advance where we might run into snags and try to predict them and come up with solutions in advance. So one of these we've already sort of alluded to is, what if multiple caregivers pick up diapers for a given child or family? And the solution is, in your MIS or whatever system you use to keep track of folks, you should give all caregivers from the same family the same diaper ID, and only one of those adults should fill out the BES, ideally whichever time the adult comes the first time. Whichever first adult comes to the site should be the one who completes the BES. What if a family has multiple children that receive diapers from a program? That's fine. All of the children should receive the same diaper ID because they're all linked to that same BES where one caregiver answered questions about each of the children for whom they are responsible for that need diapers. Sometimes there's going to be screw ups. What if you find out that a family has more than one diaper ID in your MIS? It's fine. It happens. Just email us to report the 2 IDs that should be merged. We'll keep that as a record on our end, and we'll deal with the challenge when we get the BES data to figure out what we should do with it. In the meantime, use either or any of the current diaper IDs in your intake form, but do not have them complete another BES. What if you find out multiple families have the same diaper ID in the MIS? Again, just email us, report the ID that was assigned to multiple families, and in the meantime, use that diaper ID and BES in the intake form, and we'll sit down, probably give you guys a phone call and try to figure out which families are responsible for which response in the BES. What if you encounter problems using the diaper ID instrument generator? We found we've tried to pilot test this with like 8-10 people using it at the same time. Just refresh your browser. That seems to be working most of the time. If that does not work, go ahead and email us to report the problem that you encountered and enroll the family using a dummy ID. So we're asking for 8 X's instead of the numbers in the BES, and so you can enroll folks right away using the BES and intake form, but you'll use this sort of placeholder, and we'll try to go back and figure out the solution after that. I don't want you to stop or not be able to enroll anyone because the app or the generator gets a little goofy. I think I have one more here. There we go. What if you make a mistake while using the diaper ID generator, like you selected the wrong organization name? It's fine, just discard the diaper ID on screen. I think the screen says something like clear to assign a new generator. Hit that button. You should go back to your original screen and be able to select the right organization and state and generate a new diaper ID number. What if you forgot whether you already used the diaper ID displayed on screen? Like you were ready, you knew folks were coming, you hit generate, then 5 minutes later you're talking to a parent and you can't remember whether you assigned them that number or if that number might have been left over from the previous family. It's fine. It's okay if we do not have the numbers completely sequential. Just trash that number, discard it, start over, hit that button that says clear for the next family, and generate a brand new ID while you're sitting right next to the caregiver and you know that that's a unique new number for them. And then before I stop sharing the screen for a little bit so we can all chat and I can see the chat messages and people's faces, we just wanted to provide 2 privacy and security reminders. The diaper ID should be stored in the same secure location as your other participant data and information. And then subsequently down the road, when we do receive individual level data from you all, we want to make sure that you understand that we will not receive any personally identifiable information. The diaper ID will allow us to link people on this sort of disguised or anonymous number. And so what we'll ask you to do in the future is scrub your data set of information like people's names, their social security numbers, their addresses, their phone numbers, etc. So we will use just this diaper ID as a way to connect folks' information all the way across their participation in the program. I am going to stop sharing for a little bit just so I can see folks' faces, and then we can get back to the slide deck after.
Allison, I can summarize the big question right now. It seems like the tool worked for about the first half of people, and then after that, people are just kind of getting spinning. And I think that's because right now we're using the free tool. And when we roll this out, full rollout, then we are going to be paying for a larger tool that it can allow more users at once. So if you're having trouble, I really apologize for that. I hope you'll give it a try again later. But right now, I think that's the explanation, is that we're using this limited free tool for this webinar, and it will be rolled out more broadly later.
Great. Yeah, and it looks like we need to do a little bit of quality control to make sure we have the right organizations in the tool. That would be lovely if everyone was able to check the tool again, maybe later this afternoon, and let us know whether we are missing any organizations for your grant. I know that folks may not have it fully figured out yet which of their subrecipients are enrolling people or whether they add new subrecipients or partners to their team. If you need to add folks, email us again at the diapereval@westat.com and we can make those changes for you in the tool. Do folks have other questions? What goes on in your MIS? Okay, so we are trying to design a process that will work for up to 21 grant recipients and I don't know, maybe a couple hundred subrecipients. So we're using MIS as a sort of shorthand language for whatever system or data files that you use to track the people that you serve. So you probably have an Excel sheet, a Word document. There is some way that you know that this family has started receiving services from your program and you're documenting whether they've shown up, what diapers they've received, what sizes diapers they've received, whether they've asked for additional services or referrals to services. So you may not be using what we're calling like a traditional MIS. You may be using an Excel spreadsheet, an Access database, RedCap, I'm hoping some of those things sound familiar to folks. Would we be able to find out if a family is receiving diapers from a different diaper bank within the month? That's a really interesting question, Suzanne. We will not, because the diaper ID is a sort of nonsensical generated ID. It doesn't include any information that would allow us to discern the identity of someone. I know sometimes when I use IDs, it's like the first 2 numbers are your birth month, the last 4 numbers might be, the last 4 letters may be the first letters of your last name, those kinds of things. We won't be able to figure out who the people are that are contributing data through the BES. So it would not be a tool that we could figure out whether, you know, this certain family is getting diapers at this location and also at this other location.
And that is by design, right? We don't want identifying information about your participants. This is to protect their privacy.
So then is all it going to be used for sort of the initial intake and then follow up later on then?
Yes, and I think maybe Juliana will be able to speak to this, but ideally, the BES will also provide information that you all can use as you're better understanding your service population. So the BES will contribute data both to the evaluation and then send data back to you guys. So you can go back into your files and fill in maybe some of these questions around diaper need or family income or whatever questions we have in the BES that you weren't able to ask at intake or knew you were going to get at a later date. So I think it's basically an information generating instrument that'll allow folks to connect other sources of information to the intake of the BES.
Yeah, and Molly, just to follow up on what Allison said, so we have been providing the data in aggregate right now to the grant recipients that are currently using the BES and the other cohorts, because this is a newer feature that we're rolling out with your cohort. And so we want to figure out the best way to share back with you now, probably disaggregated, so that you can make those links with the unique IDs and that this information can be useful and informative in your management systems as well. So we have to still do a little bit of exploring on our end in terms of the best like modality to get that information back to you, whether it be a drive or you know, a way to, you know, a link or something that you can pull down. We're not quite sure on that yet, but we will regularly make sure that you have access to your data. And right now we're doing it on a biweekly basis for the aggregate level. But if you want it more frequently, less frequently, we'll figure that out on a case by case basis for sure. So
That's
hopefully
great.
that
Thank you.
helps. Yeah, hopefully that helps clear some of that up.
These are some great questions we're getting. So Brandy asked, can a family decline the BES? Yes, they can. The BES is a voluntary tool. It is not connected. Your participation or completion of the BES is in no way connected in your ability to receive DDDRP services. We do encourage grant recipients and subrecipients to explain to families the value of this information. And I think OCS even has like a little cheat sheet or FAQ to help people describe the BES to potential participants. And it is really short. It's like 5 to 10 minutes, especially if you only have one kiddo, you can really respond quickly. It's all multiple choice. So we do hope that intake folks make it clear to families how important and valuable this information is. But if a family does decline using it, it has no bearing on their participation in the program. And then Janet asked a great question. How will we be able to understand the impact of diapers on family well-being if we only give the survey once at the beginning? So this is the joy of conducting an evaluation in a real world setting. We are flying the plane right alongside you guys. We will collect outcome data. We will ask these same items around family income, around diaper stress, around employment, around participation in early childhood education a second time. That's why we're doing the diaper ID. So we'll have another field that asks to put in people's same diaper IDs, and that's how we'll collect the data. The little bit of uncertainty we have right now is what exact tool we will use to collect that data. As you know, the federal government has a lot of requirements to make sure that we protect people's privacy and that we're really accurate in the amount of burden and information we're collecting from people. So we just need to work out the exact instrument and process by which we will collect that information. But we will ask you all to work with us to field items similar to, but maybe not the exact instrument in 6 to 9 months. All right, so Juliana said in the chat that she will share the FAQs and guidance, and she's also answering a question around whether folks can enroll expectant mothers in anticipation of distribution upon childbirth. And Juliana says, yes, the BES even allows you to indicate that you're expecting a child, so the data will still be relevant for folks. These are really great questions. So if folks have other questions, please drop them in. The other thing that would be really helpful for us to hear is any sort of areas of confusion or unclarity around these procedures, because we will be finalizing our guide and distributing it to folks by the end of the month. So if there are things you think folks will get confused about, like maybe we need to use a little bit more descriptive information about what we mean by an MIS, that would be helpful to know for us. I know it takes a minute to type, so I'm going to give folks one more minute before we go to the contact slide. Cheryl says, we have an MIS system that we use for all of our programs. Does the BES allow for some kind of bridge so that we don't have to duplicate entry? Well, we won't be able to give BES data in real time. If the responses that folks give to the BES are in SurveyMonkey, it won't somehow like automatically populate your MIS. So there will be some opportunities or some areas where you may have to ask additional questions or similar questions that are related to the BES. But as Juliana said, we will be providing that data back to folks. So if you look at the BES and there are items you don't feel you need to ask at intake in order to serve folks, maybe around these questions around diaper need and diaper stress, like I sometimes feel like I don't have enough diapers to keep my kiddo dry, then when that data does come back to you from OCS, you can enter it into your own MIS. And I don't know if there's a macro that you could create that would allow you to auto transfer stuff from an Excel file that comes back from SurveyMonkey into your own MIS. I think that would be a question you'd have to ask your data specialists. And it looks like now that 70 of us weren't trying to use the app at the same time, folks are getting numbers, so that's good to know. It is also good to know that we definitely need to buy the paid version. Okay, I don't want to keep folks any longer than I need to. So I'm going to go ahead and go back to sharing on the slide and give you guys our contact information. And then we can get you on your way on your lovely Friday afternoon. Okay, it is pretty easy to get a hold of folks in this evaluation. We do have a dedicated email, the diapereval@westat.com, that is monitored by staff on our team and then distributed to the appropriate folks. But there is no wrong door. You have my email in the call invite. You have Amanda's email in the call invite. So if you see any email that ends in westat.com or our previous company, insightpolicyresearch.com, you can just pop that open into an Outlook email, send the message, and we will get it to the right person. You can also always reach us through your OCS program specialist. We have regular contact with the folks at OCS, as do the federal office that is contracted to monitor our evaluation. We have a lot of email traffic that goes around on this evaluation, and we will definitely be able to respond to you pretty quickly and in conjunction with OCS if we need to. I see a
Allison,
hand that just went up.
I bet Sarah and I were going to say the same thing, but before you sign off, we've got a great question from Megan that I assume if she has the question, probably others do. She said, I got the ID and I see the sub-grantees, but as the state association, are we able to see the full state data?
I'm not sure what that means. So I think the question is the data coming back on the BES from the SurveyMonkey, right? And Juliana, correct me if I'm wrong, but I think the process for returning data to the grants is that you return, well, it would now be a data file to the grant recipient, to the project director, and they are in charge of fielding that out to their
Yes.
subrecipients.
That is correct. So Megan, you would receive as the state association, you're our grant recipient. So you would receive the data file directly back. So you would have, and we would include all of your sub-grantees within that. And then you would then divvy that out, like Allison said, and provide the data to the various organizations that are working under your grant. So hopefully that answers your question. You'll receive the full set of data like that's coming out of your grant.
And I
Right,
think maybe
so-
another thing worth mentioning in response to this question is one thing we mentioned earlier about what this is and what it's not, right? So it generates a number for you to document, but it does not document or collect data for you at all. So you will get the data from the BES. You will not get data from the Diaper ID generator. I want to make that clear. So this tool is for your subrecipients or folks conducting intake to generate IDs. And that's why you only see the sub grantees listed. Does
And
that help,
so-
Megan?
Yeah, and I want to make 2 clarifying points to that too that might be helpful. Each grant recipient has their own unique SurveyMonkey link. So you will only ever get back your own data and your subrecipients will only ever contribute through that tool. It could have been, each grant recipient has their own link. So it's unrelated to what anybody else is doing. The other point I want to make is that the Diaper ID is not as fully nonsensical as we have indicated. Each subrecipient has their own prefix in the Diaper ID number, which we can give those to you all. So then the grant recipient will be able to identify which ID numbers are associated with, Norfolk CAP versus Richmond CAP, and be able to parse that data out as needed if you do not have a centralized grant level program management information system. One other thing that occurred to me, Amanda, is we currently think that only subrecipients are enrolling participants, right? Do we have in the drop-down list grant recipients in case the lead grant organization is also enrolling individuals?
We do not, but we could add that.
So folks, what we have assumed now is that the grant recipient is sort of the umbrella organization and that subrecipients are the ones that have day-to-day contact with families. If that's not accurate, if any of you 7 lead grant recipients also enroll folks directly, please let us know and we'll need to add you to the drop down for your state. Any other questions? This has been incredibly helpful for us. We are piloting this fully with you guys, so please do bear with us. We are happy to make changes. We are happy to increase our guidance, rewrite our guidance, do a separate additional training, et cetera, whatever it takes to support you in your work. We just ask that you be honest with us and tell us if something's not working, if something is too burdensome, and we'll try really hard to make it work for you. We are very excited to be a part of this initiative and really want to demonstrate and document how the initiative is helping reach families and address diaper need throughout the U.S. Great. So we'll get this recording out to folks once it's cleaned up and ready, and we'll follow up with a written guide. And you have our contact information in the meantime if questions come up before we are able to get additional information out to you. Anything else we need to cover, Juliana?
No, I thought that was great. Thank you, Allison. Really appreciate you and the team putting this together. I think it was very informative, and I'm sure folks will reach out with any questions that come up, but and we'll look forward to the paid version of that. Of that. I think that will solve all of our problems. So thank you again.
Great. Thanks, everyone. Have a lovely weekend.